You so much, Dr. Theodoro and InMode for having us. Evoke in our practice is game changing, and the reason for that is because there's really no other device that's non-invasive, hands-free, that contours the face. You know, the only other device that has been used in a hands-free fashion is the submental cryolipolysis applicator by Cool Sculpting, and I'm going to show you some of those results, and I'll show you why, you know, we're very good at removing fat, whether it's through cryolipolysis, liposuction, you know, deoxycholic acids with Kybella, but skin tightening is kind of the holy grail here. So as I mentioned, it's cryolipolysis and radiofrequency, and again, the treatment gap is really key. So this is the group of patients in the middle group that begin to see signs of aging, but they're not really surgical candidates or they don't want to have surgery. And so the question is, how do we bridge this treatment gap? And it's very important, you know, I show this to patients. I think it's very useful for them to understand facial aging. You know, it's actually quite simple. When we're young, our faces are in an upside down triangle shape. We have high cheekbones and a tapered jawline to the chin. And as we age, the lower face, the lower third of the face becomes heavier. It becomes more lax. And we start losing volume in the middle and upper thirds of the faces. But really what people notice first are areas of laxity in the jowls and in the submental area. Those are kind of the target areas for aging. Now, if you look at cryolipolysis, I think it's very important to really look at the landscape and see how different technologies compare. If you look at cryolipolysis, first of all, I think it's been, you know, when I was training at Harvard, I trained with, you know, we had lectures by Rox Anderson, who invented this technology, and I think it was really revolutionary at the time. You know, freezing fat and causing fat reduction in a non-invasive fashion, hands-free, you know, 10 years ago was the best that was out there. The issue is with it is every subsequent treatment you do is about half as effective as the prior treatment, which is problematic to some extent because, you know, if you're repeat treating a patient, you're actually hoping to get more of a result, but the likelihood of you getting more of a result is about half, so it causes a conflict there. But the other thing is cryolipolysis really only works on fat, and it really does that in a very mild to modest fashion in most patients. So here, these are papers about safety and efficacy of cryolipolysis. The issue which constantly comes up is that skin laxity persists. And we see this with liposuction as well. You know, when you remove fat, it's just like a balloon. You know, if you remove air out of a balloon, you simply have more lax material. That's the problem. And same thing with removing fat and soft tissue. So you really have to address both components. This is an example of a submental cryolipolysis applicator, and you can see how it vacuum suctions the soft tissue in and applies the cooling technology. And this is a result of a patient that had a cool sculpting submentally. And you know, I would say, really, if you look at this result, is the fullness improved? Yes. I don't think the patient necessarily looks that much better. I think they look different. So I think we traded one problem for another. I think we removed volume, but now we have more skin laxity. In some ways, to me, the patient post looks a little older because of the skin laxity. You know, we all know that patients who tend to be heavier tend to look more youthful because the skin laxity basically is being managed by the volume. And that's really a concept that the filler industry has really picked up on. So removing volume without skin tightening is not a good thing because it leads to skin laxity. Same thing here in the lateral view. You know, there's more laxity of the skin here, and that's really the key issue. So the target is really to provide a non-invasive technology that will remodel the soft tissue and allow it to have a elevating effect, tightening effect, so that you're actually contouring the cervical mental angle and jowl and not just removing fat. Now, this is a side-by-side. Here on the left side of the screen, you can see a result with the cryolipolysis that I just showed, and on the right, you can see a patient of mine that had actually more fullness, but was treated with radiofrequency assisted liposuction. And the key thing here is that, you know, now is the right side a perfect result? No, but we addressed the volume and we addressed the soft tissue laxity. And this was all done under local anesthesia with a, you know, 16 gauge, 3 16 gauge access ports. within an hour, hour and a half. So it's quite an efficient treatment with increasingly good results over time. The results improve over time. So cool sculpting does nothing for the skin. It reduces fat minimally. And the other issue with cryolipolysis is that there is a paradoxical adipose hyperplasia. A lot of plastic surgeons that do liposuction see this probably more commonly than it is reported. There are a number of articles out there discussing how it's seriously underreported. This hypocellular, hypovascular fat that accumulates right over the applicator. Actually, the fat grows over the applicator, and it's quite remarkable when you do see it. And really, the only solution to that is probably liposuction with or without radiofrequency skin tightening. Now, non-invasive and minimally invasive radiofrequency improves skin laxity through the controlled thermal effect. You end up getting increased collagen production, elastin reorganization, and neoangiogenesis, and likely lymphangiogenesis as well. So these are some of the technologies that you can see through bipolar radiofrequency. We are able to apply a very specific and precise amount of heat to the soft tissues, which really allow for soft tissue remodeling. And I think the place where InMode really shines is control. You know, having control over energy is really key, because most of the previous technologies, either they were very safe but fell short of the target temperature and just didn't have a result, or they were perhaps lacked control and were overly aggressive and had results but also had a lot of complications. So really there's a sweet spot when talking about thermal soft tissue remodeling, where you really want to get to the target temperatures that are going to allow for the remodeling of tissue without exceeding those. And this is an example of a non-invasive bipolar radiofrequency modality. And this is frankly a challenging patient to deal with. You know, you can imagine if you're looking at the patient here on your left, this patient may come to your office, and I mean, what are you going to do? Are you going to offer them a mini facelift or a neck lift? I don't really know of any other technology short of radiofrequency that's going to reliably remodel this submental area to this extent. So here we're talking about improving skin texture and tone, as well as really, and this is another thing, you know, patients are very savvy and they understand the concept of production of new collagen, and it's very much in line with what people want today. You know, we're moving away from synthetics. If you look at the silicone, for example, breast implant industry, it's really taken a significant hit because people don't want foreign materials injected in them or being treated with it. So this is actually really augmenting your body's own collagen production and ability to tighten skin through thermal injury. And now you can see, you know, there's even an immediate effect, but really the ultimate effect is a 6 to 8 week neocollagenesis and elastin reorganization. And I have to say, with a lot of credit to InMode and Dr. Theodoro, when we were doing the trials on this hands-free technology, really, you know, Dr. Theodoro was the one that sat down and said, we need to figure out very objectively how this technology works, if it works, how well it works. And so we went to great lengths to use really what I think is some of the most objective data available to quantify this technology. So what we did in the trials of the Evoke device was we used the most sensitive 3D camera available by Quantificare, and I'll show you some of that data. This is a camera that gives you a topographic map of the face, and it shows you soft tissue remodeling, it shows you volume. For example, if you injected 1 cc of filler on the left side of someone's face and took a before and after, the camera is smart enough to tell you there's a cc difference. And it's very standardized, so you can't fool the camera, which is very important, as we know in aesthetics. It happens all too often. The other thing we did was we took biopsies on patients for not only H&E, but we also did more sophisticated imaging to look at different elements of the soft tissue with really high resolution. And then, of course, we did what we're actually in the process of right now. You know, many of the device companies, they publish data and they say, well, we had 10 objective plastic surgeons review the befores and afters. And if 75% of them can identify the before and after, that's considered a success. And what we did was, what we're in the process of doing is really polling thousands of people in the population. And what that's allowing us to do is, at the end of the day, what matters is what your patient thinks and what the population thinks. So we're really generating what I think is really exceptional and objective data here. So radio frequency, just to backtrack a little bit, is technology that's very familiar to us. It's existed for almost 100 years in medicine, which is good because we know how it works very predictably. It's only really entered the aesthetic space over the last 20 years or so through monopolar radiofrequency and now the more advanced bipolar radiofrequency, which we're talking about today. But radiofrequency essentially is an electromagnetic current that travels through tissue. And this is all dictated by Ohm's law. And what that means is you have an electrical current traveling through tissue. And in the case of bipolar radiofrequency, it's directional from one electrode to another. And what it does as it travels through different tissue types is it generates heat through resistance. So for example, fat and collagen, which happen to be the target tissues for us in the aesthetic world, have significant resistance or impedance. So you actually generate heat in those tissues preferentially. And the nice thing about radiofrequency is it's colorblind. Unlike lasers that are very chromophore specific, you can use radiofrequency safely on African American patients, on Asian patients without any concern for pigmentation issues. So really it's selectively heating those areas of interest. And these are the other minimally invasive technologies that we use frequently, the BodyTite, FaceTite, AccuTite, as well as the Morpheus fractional radiofrequency. Now, this is an important concept, especially when discussing non-invasive technology. There is a relationship between time and temperature, and it follows this curve here. And you can see the white curve here, that's soft tissue remodeling or soft tissue tightening. And basically, you can either treat tissue for a very short period of time at a very high temperature, and this is some of the plasma technology does this, and get a certain amount of soft tissue tightening. But actually, it's almost like slow cooking. If you're slow cooking brisket or something like that, to make an analogy, the lower temperature you treat the tissue for a longer period of time actually has a better and more effective collagen stimulation because you're also stimulating fibroblasts. And this is actually where I think it's an important concept, because the non-invasive face contouring Evoke technology really utilizes and takes advantage of this biological fact. So heating temperature at a consistent rate for a longer period of time is more effective than heating at a tissue at a higher temperature for a shorter period of time. Now, as we age, we know that our face changes. Really, we get heavier in the lower third of the face with the jowls and the submental laxity. So these are really the areas that we're interested in targeting. And the design of the Evoke device is very specific to those target areas. It's like there's no need to beat around the bush. You want to hit the jowls and you want to hit the submental area. Those are the two bang for the buck, most valuable areas to treat with patients where they're going to notice the impact most. Now here you can see there are 4 applicators. These are the cheek applicators. And the amazing thing here is when we did our 3D imaging, it remodels the soft tissue, so it almost gives you the appearance of more volume. But the reason for that is because it's remodeling the skin and tightening the skin to the point that it's almost fooling the technology to think that there's more volume because you've actually tightened the soft tissue envelope. So we're preferentially treating the cheek, the lower face, and jowls with this. And each of these is a bipolar applicator. So you have one electrode centrally, and then you have an outer electrode on either side. And there's 4 of these on each cheek, as well as 3 on the chin applicator. And they're very close temperature controls where you set the device ahead of time. I'll show you what the interface looks like. You set the temperature, usually it's 42, 43 degrees Celsius, and it reaches that temperature in about 2 minutes, and then it keeps the temperature very consistent. So you're acquiring the temperature and controlling it and extending it throughout the duration of the treatment. And here you can see its placement on the patient. And this is one of our patients. The Evoke trials with our great patient Amber. She's being a trooper, and it's going well so far. We just started. So this is one of our first patients. She's actually an esthetician for another plastic surgeon, and patients really like this. I mean, they come in, it's a very comfortable treatment. You know, in our busy, fast-paced lives, patients appreciate sitting in a chair for, 35, 45 minutes, being treated. And what's happening actually more and more, when we started this, we just had an empty room we dedicated to this device, and that was it. And what I came to realize is that, this is a captive audience in a room. And we have, time is of the essence because patients really care about downtime and they care about their time in general. So they're increasingly doing, dual treatments. They do body contouring and non-invasive face contouring, or the esthetician will come in and discuss some other treatments with them. So it's really an opportunity to be able to treat our patients sort of globally during the time that they're in the office, having this non-invasive, hands-free face contouring. So here you can see the applicator placed. And there's so many patients of this age category that just begin to see gel, submental laxity, and just really want an improvement in these areas. So any comments there, Spiro, or questions? I want to see if there's anything we can, maybe now's a good point to just answer.
I think a lot of really nice job, Erez. I think we're open to start taking questions right now. I think it's important because there have been a lot of questions as how this is applied and how much time and and what type of choice of patient. But I think that what's important for people to understand is when Erez and I were working on this for the last 8-9 months, initially we had to figure out the temperatures that were comfortable to the patients. So initially, the first initial protocol device that we used before, where we're using gel pads, we did get a couple burns, second degree, superficial burns, but which healed fine. But what that let us know is that this technology is actually effective. Technology that can potentially harm you always has a possibility. So the good news is we have a lot of feedback with R&D and with Dr. Michael Crandell. So we reached back and we kept on going back and forth as we beta tested this. And now these electrodes are sealed. And as a result, we don't longer have that issue. But I wanted to point that out because it's important to realize that the depth of this energy goes down to 4 millimeters. So, and the way you apply it to the neck, you have to be cognizant of what type of patient you're going to pick. And we'll talk a little bit about that once we get into the photographs. But we're ready to start taking questions. I think, Erez, your first question here is, does it work on fat reduction?
That's a really good question, and it's something that's very important. I think with radiofrequency technology, and we've looked at the science of this extensively, including our own biopsies and really using different markers to look at different components of soft tissue. I think, if you look at it from a 30,000-foot view, what's the end goal here? And I think the end goal for the patient is obviously to look better. And when people ask, about fat reduction, because the problem is we're very much in this mindset of, okay, remove fat, tighten skin, add filler, remove skin. But with radiofrequency, it actually kind of does a number of things biologically in synergy. So what happens is the thermal energy does absolutely remodel soft tissue. And by remodeling soft tissue, I mean tighten skin, increases collagen, and will remodel fat. So I wouldn't say that this is going to cause a significant volume reduction. I wouldn't use it as a fat reduction. I wouldn't call this a fat reduction technology, but it's going to remodel the gel to the point that it looks like you may have done, you may have removed some fat, but it actually has tightened the skin to give you that illusion. That's my take on it.
Yep, it's a good answer, Erez. The truth of the matter is, nowadays we're trying to retain fat, and but in the neck and the neck and jaw area, you'd want to selectively be able to remodel that. Having said that, what are the times, Erez? How long do you leave this on? How many sessions?
Right. So,
I know you're saying
so
it right here, but and how does that change with the types of patients you're picking and what kind of range of patients you'll pick depending on that?
right. So what we've done is we usually do a treatment every 2 weeks. It's 45 minutes per applicator. And the one thing I do want to mention about this device that I'll tell you from a young plastic surgeon standpoint is very important. No matter what with technology, we have to be realistic. There's going to be, I would say, out of the patients we've treated, which has been quite a few, there's maybe 5% or 10% that say, I wish I had a little more, a little more. And you can and usually I treat them 3 times. We do it in 3 to 4 treatments. Now, the nice thing about not having a disposable with this technology is that you can give them an additional treatment. They feel a significant value, but it didn't really cost you anything. And I think that's an important point practically, because I know I don't have cryolipolysis here, I don't offer it, but I know that with those technologies, when you do have a high disposable cost, it changes that a little bit in terms of your willingness to add additional treatments or your ability to.
Second question, Erez, is does the energy increase gradually to ramp up the temperature slowly, similar to Palaviv and ThermiSmooth, although they're not hands-free, making it more comfortable than Thermage? In other
Right.
words,
Mhm.
and I know that at least our patients in New York, we had to initially start off with 38 degrees and gradually ramped up to 40, 41. And most of the
Right.
patients in the study in our center were around 40. We found that
Mhm.
easy to tolerate. Erez, was your experience any different?
We actually usually go up to 42, 43, and patients
Right.
tolerate it well. We usually titrate it within the first couple minutes of the treatment. And I actually, to your point, Spiro, I think that the moving away, when you seal the electrodes, it actually makes it a lot more comfortable. And I think the modifications made to the device have actually been significant because it allows for good contact. And the other important thing about the device is it's truly hands-free because you can leave the patient in the room safely. There's a little button that the patient has in their hand, and if they press that button, the treatment pauses. So I feel very safe leaving the patient in the room with this device on.
Um, so here we have another question, Erez. Thank you for that answer. The bottom line is you're in charge of the temperature. So once you set it, it doesn't automatically go up on its own. You're setting it to where you want it to be, but it
Right.
continuously keeps it within where exactly you set it at. So the electrodes are alternating, and the whole time you want uniform tightening and uniform heating, and the machine is smart enough to do that as it does. So depending on, obviously you don't want the patient moving or anything like that, but even if the patient is moving, the electrodes are calibrated in such a way where they're continuously adjusting to keep that temperature uniform. Do you find the
Right.
same
That's
thing?
really the success of this device, I think, is all that. It's all in the software and ability to maintain that temperature at a very precise way.
I have another question, Erez. Does a treatment should it be concluded when the results are satisfactory to the patient or according to the physician's discretion?
Well, I think like anything else, it's like a bell curve. I think, within a standard deviation of average, most patients are going to be very satisfied after 3 or 4 treatments. But, there's always a couple outliers, plus or minus. So I think, at the end of the day, it's always physician discretion, whether you add a treatment or not.
That's absolutely right. I mean, we've been doing treatments, 5, 6, 7 treatments, just to evaluate the end goals and where we need to get to. But the study was based on 3 treatments. Now you can modify as we get more comfortable and more experience with the device. Would you find it true, Rez, that we can modify these patients, and depending on what you want to achieve, you could either decrease the energy or increase the length of period of time or treatments. So we're
Absolutely.
still in the beginning of this technology. Would you find that to be true?
Absolutely. And I'd also say, radio frequency has been proven to be very safe. So, I think more treatments can only be better. I don't think that there's much of a downside to it. And when patients ask, how long is this going to last? It's a very common question because they're so used to this, the filler world or other technologies where you have to come back every 6 or 8 months. I mean, this is developing collagen. This is a long-lasting treatment modality. And the other thing is, as we become more experienced with it, we may develop maintenance programs. where, maybe you come in, once every few months or once a year to just maintain. And I think patients are very amenable to that. And it's good for us too, because, practically it keeps them engaged and keeps them, in our offices.
Another question, Erez. Thank you for that. Any thoughts on using Evoke to improve skin quality and vascularity prior to facelifts to enhance the outcome surgery? This is from Dr. Forley. That's a really good question.
That's actually a great question, and I'm glad you brought that up. We actually did a study, Spiro and I and some others, looking at lymphatics and looking at perfusion with radiofrequency. Because what was happening was, we'd go to these meetings and discuss minimally invasive radiofrequency technology. And they were, like anything else, some of the more senior surgeons would say, well, how do you know, the more senior facelift surgeons in particular, how do you know this is not, affecting vascularity, you're causing temperatures that are this high, and how do you know you're not affecting the patient's overall candidacy for a facelift, neck lift, or some kind of excisional procedure? So what we did was we took the most sensitive perfusion and lymphatic imaging technology available, which is the Stryker SPY-Phi indocyanine green, and we looked at radiofrequency before and after. And actually, and if you look at the animal studies and biologic studies that have been done for many years previously, in the early 90s even, radiofrequency increases VEGF, vascular endothelial growth factor, and causes neoangiogenesis. So you're absolutely right. That question was actually very important, because not only will it not negatively impact any further intervention, it may actually augment vascularity and lymphatic drainage.
Thank you, Erez. That was a very good answer. So does the machine measure the deep temperature and skin temperature at the same time?
Right, so the device itself, if you look at the actual applicator, and I'll show it to you again, it has temperature, very tight temperature controls between the applicators. So it's really measuring it. Really, at the end of the day, what we care about most is skin surface temperature, because that's where our endpoint is. And we know the depth that the energy is moving to between these electrodes. So the depth is consistent. What we're measuring is surface temperature.
Erez, could you go back to that slide, please?
Mm-hmm. Yep.
And we have another technical question. Sculpture and Cool Mini have problems with slight movement of the applicators, making contact suddenly unsatisfactory and the cycle stops. How common is this with Evoke?
Oh, that's a great question. I'm glad someone asked that. So two things here. First of all, the device is very smart, and if it becomes uncoupled or if it has a bad contact, that electrode does not fire. And naturally, we have patients with wider jaws and more narrow jaws. The device is very customizable, but in the event that you have a patient that for whatever reason their anatomy doesn't allow all electrodes to seat well, you can actually on the device itself turn off. I'll show you this. Let me see. See here. You see the person's face here, and actually here are the applicators. This is a submental. You can't see it so well because it's a little blurred out, but if you just press on either of those applicators, it'll turn it on and off. So you can actually decide which electrodes are turned on, which ones are turned off. And if there happens to be bad coupling for whatever reason, the device will make a kind of unpleasant beep, so you'll know it, and it also won't fire. So it's built into the device. It's quite safe. It rarely happens.
Erez, this is a good question from Dr. Ron Shelton. So you're saying basically that you have the ability to customize the treatment?
Exactly. I mean, my preference is to have all electrodes firing. I think more is better in this case, but you can absolutely customize. If the patient only has a little bit of pre-gel and you don't see the need to treat more posteriorly, you can just have those electrodes on.
So you can selectively tighten areas where you want to tighten, right?
Exactly.
Here's another question, Erez. What would your recommendations be with a patient with HA filler in the lower face? Would you treat for face applicator? So the
yes.
Applicator, yeah.
Yeah, so I would say with hyaluronic acid, typically it's placed they call them dermal fillers, but typically they're really in the subcutaneous tissue. We haven't seen any issues with that. I mean, for patients that have fillers in the, typically fillers are placed in the mid-face, tear trough, cheeks. Here we're really treating the lower third of the face. When you look at aging, you want to volumize the middle third, and you want to actually tighten the lower third and neck. But we haven't seen an issue with HA fillers and treatment with radiofrequency. I think actually, to be honest with you, I think fillers have been kind of misused. I think a lot of filler applications are actually trying to treat skin laxity. And I think we're kind of beating around the bush with fillers by trying to fill the volume, whereas this really remodels the tissue the way it should be remodeled.
Thank you, Erez. I think that was a great question. I think it's important to understand that fillers will melt at 1,000 degrees Celsius. So the Bovie tip during surgery, that will melt filler. But typically fillers do not melt, at least the majority of the fillers that we are aware of, do not melt at this temperature that we're currently achieving, up to 43 degrees Celsius. So we don't recommend that you do it together with fillers at the same time, only because you might have a little swelling with fillers and might distort a little bit of the anatomy of what you want to do. And probably it's a good idea always to wait a little bit when you apply. But technically, there should not be any concern about this melting filler because it's just not hot enough. Would you find that to be true, Erez? Or I mean,
Yeah,
that's the science
absolutely.
sort of behind it.
Right. Yeah, I would agree with that.
Okay, let's just continue. I know we have a lot of questions here. Could you
Sure.
show us a little bit the cheek applicator and how it works and talk us through this part here, Erez?
Yeah, absolutely. So this is actually the engineer who made this, who's a Russian nuclear engineer, Michael Kreindel. And, I think it's actually a great demonstration because what you see with the near infrared thermal imaging is a heat signature that's maintained. This image here is an hour post-treatment. And the point here is you're volumetrically heating the soft tissue, and you want that heat signature to maintain itself for as long as possible after the treatment. So this is not like some of the plasma technologies that are like almost like a flash burn, like very hot temperature, 80 degrees Celsius for milliseconds. This is like a slow but very consistent and efficient delivery of energy that volumetrically is heating the soft tissue. And I can get into some of the results. This is Quantificare data. This is from Dr. Theodoro's site here. This cervical mental angle is probably the biggest issue for majority of patients. And what's really important about this technology is it's treating this lower face area and it's treating the cervical mental angle in a very targeted fashion. So just a 10-degree improvement of the cervical mental angle actually changes, I think, your whole facial appearance pretty significantly. And this technology really can achieve that, and the Quantificare camera allows us to see that pretty remarkably. Looking at the here, you can see the deeper blue shows volume losses, and this is actually a picture overlaid. This is about a month and a half result. This is a patient of ours, where you can see her pre and post overlaid. And that's, to me, that's pretty substantial for a non-invasive treatment.
I got another question, Erez, from Dr. Stephen Weiner. Do you have any histology of the fat or MRI to show remodeling? And I know we actually have obviously the Quantificare camera, but you might want to talk a little bit about the biopsies and what you're doing with them as far as what you've seen so far.
Sure. So the answer is yes. We've actually taken biopsies on all our patients at every treatment juncture. And it's interesting you asked that because, we started looking at, just thickness of collagen and fat, hematin and H&E stains. And now we're getting into, a little bit more sophisticated imaging. I don't know, we're publishing it soon, so I don't know how much I can divulge there, but we're looking at various.
It's a good question. We'll have an answer for you hopefully soon.
Yeah, but I can tell you, that we're actually working with the local universities with their, sophisticated microscopy, looking at different components of this in very high fidelity.
And Steve, thank you for your comment. RF doesn't melt filler. We know that, but they're heated to 115 degrees Celsius for 15 minutes to sterilize them prior to shipping. So that'll answer hopefully some other questions that people might have concerns about. So Erez, the question comes up about fat atrophy, especially in the midface. Would you mind discussing a little bit about how you're customizing the cheek applicators to address a specific type of patient? In other words, would you do anything different for someone who wants a submalar hollow or a buccal fat pad excision, or wants that look, versus someone who's already quite thin and has only wants tightening? You know, how would you modify the applicators on the cheek face applicators to avoid that problem that's been seen in the past with Thermage and Ulthera?
Right, so it's a great question. You know, I think when we look at facial aging, we really have to break the face up into thirds. So we have the upper third above the eyebrows, the middle third between the eyebrows and the kind of columella lip junction, and then lower third from the upper lip all the way down. And, you know, if you look at the science of facial aging, it's really evolved quite a bit over the last 20 years. You know, a lot of patients that come in for facial rejuvenation, especially facelifts, are very concerned about this wind-swept, you know, skin-tightened appearance. And the reason for that is back, you know, before we understood fat compartments, people were just yanking on skin, really pulling skin hard. And now we have a much more sophisticated understanding through the work of PESA, and you know, the Germans also did MRI studies looking at fat compartments of the face. So it's a very timely question. The mid-face fat compartments, you know, there are numerous papers by Roerich and PESA looking at fat compartments of the face, and you have a deep malar fat compartment, you have a nasolabial fat compartment, and those are typically the ones that go first and diminish. So I agree, the mid-face benefits from volumization, and that's why most facelift surgeons are re-injecting fat to revolumize those deflated fat compartments. However, the lower part of the face is really where you are losing fat, and as a result have skin laxity, so it's a combined problem. So what you really need is to volumize kind of the mid-face, but to tighten and remodel the lower face. So it's kind of two different things.
Okay, great. Want to show us some of the end results you had there? We have Erez.
Yeah, absolutely. And you know, to that question here, you know, if you can remodel some of this soft tissue and tighten it, that will allow for a tighter cervical mental angle. And you know, that's actually, I'm glad it's a good timing for that question. So there's numerous studies. This is looking at human fat cells. This was done in the mid-90s. And basically, you know, at the temperatures that we're heating, you will remodel some of the fat, which is desirable. But, you know, again, to the analogy of the cryolipolysis, it's only desirable if you can back it up with skin tightening on top of it. That's the key. Just removing fat alone is like taking a grape and making it look like a raisin. What you want to do is remove some of that fat, not totally skeletonize it, obviously, but remodel it. And here you can see in this paper, the heat injury of 43 to 44 degrees Celsius, they observed apoptosis in about 10% of their adipocytes, which is perfect. You want to remodel the fat and, more importantly, tighten the skin on top of it. So, you know, in our practice, we've used this technology mostly in the treatment gap patients. I will say that there are a number of patients that are not interested in surgery, are willing to take a more modest result, but are candidates for an excisional procedure. And frankly, they really have enjoyed this technology and the results that have come from it. And, you know, as a new plastic surgeon in town and a relatively young plastic surgeon, some of our best referrals for these radiofrequency skin tightening modalities are other plastic surgeons that have done excisional procedures and have some laxity and just don't have the technology to correct it non-invasively.
Okay. Erez, would you mind fast forwarding to the results at the end, a couple more cases if you don't mind? Or
yeah, these are the cases we have here. And yeah.
So I know we have photographs up to 8 months out. I know I can't see exactly how many months you're showing right here, but would you tell us a little bit about the progress post-op and what to expect when you discuss it with patients? In other words, we know that using radiofrequency and tightening, because it's a form of thermal injury, you're going to get tightening for 1 year, up to 1 year. But what do you explain patients? What do you tell them what to expect as a result, and how long do they have to wait for that?
Right, that's an important point. So I would say the one potential downside of radiofrequency is you have to continuously tell patients this is a long game. So this is going to take 6 to 8 weeks to begin seeing a significant result. And as you said, Spiro, that result actually improves over time, and many patients realize that it improves over time. So it's not an immediate result, and I make sure to to ensure that the patients know that. And I agree with you. I think the result improves over a longer period of time than we even realize.
Okay, great. Natalie, we don't have any more questions. I believe that concludes our session. But I know that we are in the process of submitting everything for publication, and hopefully as we do, we'll be releasing more information to you guys. I think it's important to understand that we're at the beginning of this technology in some ways not. RF is not a new technology, but the ability to control that temperature uniformly is actually is something that differentiates this from other devices, and get a reproducible result. So, but I think I can't stress enough the patient selection. I think it's important to understand that if you have patients that have, for example, bands, or you have to use your normal way of assessing patients' facial aging and necks, and to be able to offer a full solution. So just because this device is a hammer does not mean the whole world's a nail. Wouldn't you agree with that, Erez? I mean,
Absolutely, absolutely.
right. So thank you very much, everybody, for attending. Erez, thank you for a wonderful job.
Thank you.
And
Thank
as we're
you.
getting our results out to 1 year, we'll be able to share those with you guys too, and hopefully get better and better and more scientific as we move along. Thank you very much.
Thank you.